Welcome back. We've missed working with veterans and are excited to begin bringing everyone back to the risk in a safe manner. It's been a long year, but we have been hard at work getting our lab back up and running for both our research and clinical programs. These programs aim at improving the health of the veterans we see, so we appreciate your patience. For the past few months, we've been preparing and implementing changes to ensure the safety of all our patients and staff in light of the COVID-19 pandemic. While safety and a clean environment has always been a priority here at The Risk, we have gone above and beyond to ensure that we meet all standards set forth by the Centers for Disease Control. This quick video will provide an inside look at what we've been working on. We can't wait to welcome you back in person, wearing a mask, of course. When you arrive at the East Orange campus, you will enter the main entrance of Building 1. The Risk is located on the 11th floor. After going through local VA screening procedures, please make your way to the 11th floor. Once you arrive, you'll be greeted by our front desk administrative corps and they will notify us of your arrival. You will be directed to our waiting room where chairs will be set 6 feet apart to ensure proper social distancing. Once the team is ready, a lab member will come and introduce themselves and walk you to the cardiorespiratory lab. Upon entry, we ask both the staff and the veteran to sanitize their hands. Once your visit is complete, you will sanitize your hands before exiting the lab. Our staff are taking precautions to ensure overall safety during testing procedures here at The Risk. Some procedures are classified as aerosol generating, which can carry a higher probability of transmitting COVID-19. In preparation for your visit, we have built a supply closet specifically for personal protective equipment, or PPE, for the staff. Our full PPE requirements include an isolation gown, a N95 mask, a surgical mask, a face shield or glasses, and gloves. All team members have been fit for our N95 mask by Garden State Environmental. To further ensure safety, we have also limited our lab occupancy to essential members only. Following these steps will allow us to keep our staff and veterans safe from any potential exposure.
A major priority here at The Risk is to ensure the safety of everyone present. Our team has converted the cardiorespiratory lab into a negative pressure room. This will ensure that the air in the lab is being removed from the lab to the outdoors by a HEPA-filtered negative pressure unit. Our unit is inside the lab attached to a window, ensuring that the air is being pulled and expelled outside. This helps prevent air and any other possible pathogens exhaled during our breathing or exercise procedures from escaping to the hallway where people are not wearing proper respiratory protection, like the staff in the lab. The constant change of the air will also make sure patients and the staff members in the room are not breathing in stagnant air and there is ample air clearance in the room. The pressure in the room will be constantly monitored by our sensors when in use. If the negative pressure in the room were to fall below a specific range, the alarm will go off notifying the team. Maintaining a negative pressure environment is a crucial part of protecting you and our staff. We also have 2 additional HEPA filter units in place that will purify the air inside the lab close to where the testing procedures are being performed to ensure that the lab meets all recommendations for a negative pressure room.
After each testing procedure, the equipment will be completely sanitized using the recommended Purple Top cleaning wipes. These wipes are a disinfecting staple in the medical field. Equipment that cannot be wiped down and needs further disinfection will be sent down to the hospital's sterile processing center for further decontamination. As always, disinfecting and cleaning is a top priority for our lab.
Our staff has gone above and beyond in ensuring that you enter a clean lab. So much so that we aren't only disinfecting the lab manually, but also by UV light. Our germ zapping robot uses UV light to clean the entire room, hitting nooks and crannies and manual cleaning misses, giving the room some tough love. After each patient, the lab will be manually cleaned, then topped off with our UV power Febreze. UV light disinfecting has changed the game in the constant battle against germs, and allows us to focus on what's more important, providing you with a safe and noteworthy experience. On the front of the cardiorespiratory lab, you will find signs that signal to the hospital and risk personnel the status of the lab and if and how they may enter the room. Green status means that the lab is not currently in use and has been decontaminated from any prior patient visits. During the green status, personnel can enter the room with only a personal mask and are asked to keep the mask on while inside. The yellow status indicates that there is a veteran in the room undergoing a non-aerosol generating procedure. Both the staff member and the veteran inside will be asked to wear their personal masks throughout the procedures. Entry into the room is limited to required personnel wearing their personal masks. We have 2 red signs. The first one indicates that there is testing in progress that is considered high aerosol generating. During this stage, entering the room is limited to required personnel only wearing full PPE. The veteran will be asked to wear their personal mask whenever possible. The second red sign is indicating that tough love is in use. During this period, no entry is allowed inside the room. During your visit here at the risk, a cardiopulmonary exercise test may be part of your evaluation. This test is considered a high-risk aerosol-generating procedure. Therefore, you have taken multiple steps to ensure both yours and the staff's safety. During these procedures, all staff members will be appropriately protected wearing full PPE. You, as the veteran and the patient, will be asked to wear your personal mask until the testing procedures begin, at which point we'll ask you to wear the blue mask seen here in the video, which helps collect our data. This mask is now lined with an antibacterial filter to prevent spreading infections. As always, you'll be monitored by a clinical exercise physiologist throughout the test to ensure safety. Our team members are looking forward to inviting veterans back on site. We hope that this highlight video illustrated all the steps we have taken to ensure your safety when visiting the risk. Thank you for taking your time to watch this video. It's been a long year, but here at the risk we're excited to move forward and continue to help our veterans throughout the nation as best we can.